Yvonne Kemuma, KUTV.
Now, shortage of essential drugs in Siaya County's public hospitals is leaving patients vulnerable and forcing low-income families to seek costly alternatives. Speaking at a community baraza in Central Game Member of Parliament Elisha Odhiambo criticized the county government for what he termed as gross negligence in addressing healthcare needs. Odhiambo emphasized that the ongoing crisis in public hospitals is a clear indication of failed priorities, urging immediate intervention to prevent further loss of lives.
The Member of Parliament for Game constituency, Elisha Odhiambo, has sounded the alarm over the dire state of healthcare in Siaya County, citing a persistent shortage of essential drugs and medical supplies in public hospitals. He expressed concern that the crisis is endangering the lives of unprivileged residents, many of them who are forced to seek costly treatment in private facilities. Odhiambo, who addressed the public during a baraza at Congo Primary Grounds in Central Game after attending the funeral of late Mama Adongo, urged county leaders to take immediate action and criticized the Siaya County government for failing to uphold its commitment to healthcare delivery, especially after making its central theme of pre-election promises.
To Joseph, and she died because she was in Yala and Siaya Hospital and there was no medicine. I'm appealing to the leadership of Siaya. When you're being elected, you said your number one priority was to ensure that hospitals have drugs.
Additionally, Odhiambo urged Siaya Governor James Orengo to honor his campaign pledges and prioritize the improvement of healthcare services across the county. He emphasized the need for Governor Orengo to take a proactive role in resolving the crisis, stating that leadership should be felt through tangible service delivery in the healthcare sector.
I'm appealing to the governor. If you want to be remembered at all, you should be remembered because our hospitals have drugs for these ordinary people, not to die because there are no drugs in the hospitals.
The Member of Parliament directed a strong appeal to National Assembly Budget Committee Chair and Alego Usonga MP Samuel Atandi, calling him to advocate equitable national resource allocation that will benefit Siaya County.
Head of budget, the chairman of budget, Ndindi Nyoro, allocated Muranga, his constituency, 7 billion. I'm also appealing to the chairman of budget of Siaya, Samatandi. You must allocate in Siaya minimum 10 billion. Because Ndindi Nyoro was a chairman like you. You should also use your authority to ensure that our people benefit from your position.
Odhiambo remarks have amplified growing calls for immediate reforms in Siaya's healthcare systems. The Member of Parliament urged both county and national leaders to act swiftly, stressing that quality medical services are a basic right and must not be a privilege reserved only for those who can afford private care. Elimelech Mudori, KUTV.
Now, that story was produced by very own